Hi, I'm Caroline Stocks with Pig Health Today, and with me is Laura Carroll, who's a swine veterinarian at Four Star Veterinary Service. Laura, thanks so much for joining us today.
Thank you for having me.
Now, we're talking about raising pigs without antibiotics. That's something that your practice in Pennsylvania has done a lot of work on. In terms of managing pig health, you're perhaps using tools that are not necessarily used in conventional systems. Can you explain a little bit about the basics of managing pig health in those systems?
Yeah, absolutely. I think it's important that we are always remembering the basics, when we're managing pig health. I think we found with antibiotic-free production that the basics are even that much more important. So feed, water, and air. It seems really silly and simple because it is. But we're asking a lot of our caretakers, and sometimes they're so involved in other projects and other tasks that we forget the basics. So things like making sure the ventilation is appropriate, making sure that we have good access to feed, the water supply is adequate, we've got the right number of nipples in a pen, for example. Things like that are very important. Vaccinations is another component of that. Of course, commercial and autogenous vaccinations we utilize quite a bit to make sure we're preventing some disease challenges from occurring. And then lastly, we're using a lot of tools, supplements, acidifiers, probiotics, et cetera, to manage disease challenges as they arise.
So how important is the relationship between the veterinarian and the client and the patient in these systems?
Yeah, it's very important, right? So I think it's important that all the producers work with their veterinarians to figure out which intervention is the best for their farm and their specific situation. Sometimes in these antibiotic-free production systems, we have to be a little bit creative in terms of managing pig health and figuring out ways to produce high-quality pigs. So it's important to have a lot of conversations and veterinary oversight to figure out what the best plan is.
So potentially then, are those relationships more important than they would be in conventional systems?
I think they're always important, but I think sometimes these systems do require a little bit more veterinary oversight. We certainly want to make sure we're on top of any disease challenges as they arise, just because we are limited in the tools in our toolbox that we can utilize.
So you mentioned some of the tools that are actually available then in these systems, and one of them is acidifiers to improve gut health. Can you explain a little bit about how those work?
Sure. So we use acidifiers mostly to reduce the pH in the GI tract to make it a more acidic environment. And that's important, one, because some of the bacteria, harmful bacteria that we deal with, they like to live in more alkaline, more basic pH environments. And so if we can provide an acidic environment to the pigs, then we're reducing the growth of those potentially harmful bacteria. The other component of acidifiers, especially when we're talking about wean pigs, is that they lack the ability themselves to produce a lot of acid in their gut to help break down feed. Acid's important to help break down the feed and for digestion. And so if we can provide some acidifiers to the diet or through the water, then we're making digestion a lot easier on that pig.
So what age would you typically give them?
Yeah, so we do start out with some of those in the farrowing house, especially if they're utilizing a creep feed in there. And then we're also using that very commonly in the nursery, especially around weaning time within the first couple weeks after weaning.
Do you have any examples that you've used in your own practice where they've worked especially well?
Yeah, I think so. We utilize them a lot, again, at weaning, kind of that placement in the nursery. That can be somewhat of a stressful time, and those pigs don't always want to get started well on feed. So a lot of times we'll administer acidifiers through the water and even maybe top dress that on the feed, and that really helps to kind of get these pigs started well.
So prebiotics and probiotics are another alternative. Can you explain a little bit about those as well?
Sure. So, in the GI tract, we have a balance of good bacteria and bad bacteria. And in a healthy animal, they're in a nice symbiotic relationship, and they're both at good levels. When an animal undergoes stress, for example, or if they're going through a disease challenge, that balance can get tipped, and we can have growth of some negative bacteria. So we utilize prebiotics and probiotics basically to make sure that we're getting the good bacteria in the GI tract. So Prebiotics, for example, are used to help promote the growth of that good bacteria, almost like a fertilizer for the good bacteria in the GI tract. Probiotics are the good bacteria themselves. Lots of times these are live culture or live organisms that we're utilizing and putting those kind of directly in the pigs so that we're promoting the growth of the good bacteria.
So is there any benefit of using probiotics over prebiotics or vice versa, or would you perhaps suggest using both?
Many times we use both, right? Because we're really trying to promote the growth of that good bacteria, and lots of times they work in conjunction and are provided in conjunction.
So what kind of situations would you actually use probiotics and prebiotics with clients?
Yeah, so lots of times we're using that in cases where we might have a lot of enteric disease challenges and times of stress. So weaning is another example of that, where we might see a disruption in the kind of gut microflora, and we want to make sure we're promoting a good, healthy gut.
So nutritional supplements, they're used to support hydration and nutrition. How well do they work, and in what situations would people use them?
Yeah, so we utilize nutritional supplements in many cases when pigs just aren't feeling well. So that could be from stress of weaning, for example, or when they're undergoing disease challenges. So especially in our younger animals, they don't have a lot of energy reserve. So when they get sick and they're not eating and drinking well, they're depleting a lot of their energy sources. Also, in cases of diarrhea, there could be a lot of fluid loss. And so we need to try to replace those electrolytes, replace some nutrition in these animals, keep them hydrated so we can keep them going. Nursing piglets and wean pigs, it requires a lot of energy to nurse, and it requires energy to get up to the feeder and to get to the drinker. And so we want to make sure that we're trying to provide them supplements to keep their energy levels up and keep these pigs going.
So we've covered quite a few tools there. It sounds like there's a lot of potential opportunities for farmers to use different options. Do you tend to prescribe a number of them, or do you just try one at a time? How does it actually work in practice?
Yeah, that's a good question. I think every situation's different, right? And it depends on the challenges that we're facing. Many times these can be used, in conjunction with each other. And certainly in our commercial systems, we utilize a lot of these products, either to replace some antibiotics or in conjunction with antibiotics. They are a nice supplement. And certainly from an animal welfare standpoint, I think improves how we're handling our pigs when they're going through some stress.
And how difficult is it for farmers to manage these products? Because I'm guessing that quite a few of them are very different to things that they've been used to in the past.
Yes, it can be. That's where I think the veterinary oversight component is very important to make sure they're understanding how to use these products and when they need to be using these products.
And in terms of cost, how expensive are some of these treatments as well? Because similar products for human health can be quite expensive.
That's right. Yeah, I would say it's across the board, to be honest with you. We've found some more inexpensive ways to probably utilize some of these products, but it can be all over the board.
And just finally, do you use any of these products actually on farms that do use antibiotics, and do you use other products?
Oh, sure, a good bit. Yes, we've taken a lot of the tools that we've used in antibiotic-free production and have brought that over to the commercial side, and it's worked very well.
So there's lots to be learned from both sides.
Absolutely, yes.
Okay, great stuff. I've been speaking to Laura Carroll, who's a swine veterinarian with Four Star Veterinary Service in Pennsylvania.